assessment and diagnostic tools to determine fetal well-being. So there's kick counts. It's very low tech. Mom's usually taught around 28 weeks, maybe earlier. You want her to lie on her side and see if she can count 10 kicks in 1 to 2 hours. There's no real consensus, but that's in a lot of the literature. 10 kicks in 1 to 2 hours is what you want to feel. Sometimes drinking a glass of juice or water will help if you're sort of not sure what you're feeling. Ultrasound is non-invasive, painless, there's no radiation. That's intermittent high-frequency sound waves, and they're transmitted by alternating current to a transducer applied to the abdomen. So again, we talked about transabdominal, which is on the outsides, external. You're going to have a full bladder. Transvaginal or internal exam, you want patients to have an empty bladder. Ultrasound helps with early identification of pregnancy with fetal heartbeat and breathing movements, identifying more than one embryo or fetus. It can detect some anomalies, the location of the placenta, and it accompanies the CVS and amniocentesis, those internal invasive exams and diagnostic tools. So a non-stress test, which we've talked about a lot on this slide deck, which you're going to give to anyone that has any kind of issue, any kind of mom that comes in and says, I don't feel my baby move, I'm post-dates, I'm 42 weeks pregnant, I've been in a car accident, I had some kind of trauma, I have gestational diabetes, I have preeclampsia, I have blood pressure issues. Anyone in the high-risk category is going to get a non-stress test. So it can be done alone or part of a biophysical profile after 32 weeks. What you're doing is you're putting a TOCO. So TOCO for contractions, ultrasound for fetal heart rate. You're putting them on mom and you're observing the fetal heart rate and accelerations and variability. You're going to assess the fetus. What it's doing is it's assessing the fetus with adequate oxygenation and an intact central nervous system. So we're going to talk all about this in Module 2, but for this module, you do need to know that non-stress tests are usually for any woman that's in high risk. So decreased fetal movement, diabetes, hypertension, the baby's small or not growing properly, the baby's too big. After an amniocentesis, if she's post-dates, you want to really know why and when people would get a non-stress test. And again, a biophysical profile, that's another way to determine fetal well-being. So that can be part of, the non-stress test can be part of a BPP, or the non-stress test can be done on its own. The rest of the biophysical profile is you're looking at breathing, you're looking at movement, you're looking at tone, and you're looking at amniotic fluid volume. Basically, you're looking to see, can this baby stay in utero or does this baby need to be born? How well is the baby doing inside as opposed to, is it just time for baby to come out and be born?